Every morning, your doctor probably told you to eat oatmeal with fruit and drink a glass of orange juice. Maybe a nutritionist said it. Maybe you read it in a health magazine. Maybe you have been eating this exact breakfast for 20, 30 years, convinced it is the single best thing you can do for your body before the day starts. I am going to show you what that breakfast is actually doing inside your cells, not what the package says, not what the health guidelines say, what the research, when you read the full study, not the headline, actually shows. And what it shows is going to disturb you. Because the breakfast that millions of seniors eat every morning as a health ritual is, according to the metabolic science, creating the exact internal environment that cancer cells require to grow. Right now, in research clinics around the world, scientists are using a device called a continuous glucose monitor, a small sensor that sits under the skin and reads blood sugar in real time, every few minutes, all day. We used to reserve these for diabetics, but when researchers began fitting them on healthy seniors, people with no diabetes diagnosis, no symptoms, normal fasting glucose, and feeding them the standard recommended breakfast, what appeared on those monitors stopped people cold. A 67-year-old woman with no diabetes diagnosis eats instant oatmeal with blueberries and a glass of orange juice. Within 45 minutes, her blood glucose reaches 172 milligrams per deciliter. That is the level we use to diagnose diabetes in a fasting test. She hit it from breakfast, from the breakfast that every health organization in America recommends to seniors. I am Dr. Edward. I am an emergency medicine physician, and I have spent 20 years studying the connection between metabolic health and disease progression in older adults. After reviewing the research on postprandial glucose, insulin signaling, and cancer cell metabolism, I cannot stay quiet about what the data shows, so that is why I made this video. In the next 25 minutes, I am going to show you exactly why that number, 172, matters at the cellular level. I am going to explain the Nobel Prize-winning science that connects your morning blood sugar spike to cancer cell proliferation. I am going to bust 4 myths about so-called healthy breakfast foods that most seniors eat every day, and I am going to give you the exact replacement protocol, specific foods, specific amounts, specific timing, that my patients have used with measurable results on their labs. Not general advice, exact science. Quick favor before we go deeper. I get messages every week from seniors who have been watching my videos for months and did not realize they were not subscribed. 2 seconds, completely free. Please check right now and subscribe. This channel reaches people who genuinely need this information, and your subscription is how it grows. Now let me show you what is happening inside your body every single morning. Let us start with what oatmeal actually does to your blood sugar, because this is where most people's understanding is completely backwards. You have been told that oatmeal is a complex carbohydrate and that complex carbohydrates are slow-burning and safe. That is partially true for one very specific form of oatmeal. But what most seniors eat every morning is not whole groats. It is not steel-cut oats. It is instant oatmeal, or quick-cook rolled oats, which have been pre-cooked, rolled flat, and dried, a process that destroys most of the fiber structure that would otherwise slow glucose absorption. Here is a number that should stop you. The glycemic index of instant oatmeal is 83. White bread is 75. A chocolate bar is 70. The breakfast sold as a health food creates a larger and faster glucose spike than a piece of white bread, and most people have no idea. Even steel-cut oats, the least processed version, carry a glycemic index of 55. Better, but still significant. And here is what nobody tells you. When you add fruit on top, bananas, sliced peaches, even blueberries, and then drink a glass of orange juice alongside it, you are stacking 3 simultaneous glucose sources. Your digestive system processes all 3 at the same time. The result is not additive, it is exponential. A study published in the journal Diabetes Care measured blood glucose responses in adults over 60 to common breakfast combinations. Oatmeal alone produced a significant spike. Adding fruit raised that peak by 27%. Adding orange juice pushed the combined response to a level metabolically equivalent to drinking a 12-ounce can of regular soda. Not diet, regular, that is the so-called healthy breakfast. Now you might be thinking, my blood sugar comes back down. It spikes and normalizes. My doctor said my fasting glucose is fine. What is the real problem? Here is the problem. And this is where the science becomes serious. Every time your blood sugar spikes high, your pancreas floods your bloodstream with insulin to bring it back down. Insulin is not just a blood sugar regulator. Insulin is one of the most potent cell growth hormones in the human body. When insulin surges, it sends a message to cells throughout your body: grow, divide, multiply. For healthy cells with functional mitochondria, that growth signal is carefully regulated. The cell receives it, responds appropriately, and the signal shuts off. But for cells with damaged mitochondria, cells that have shifted into an abnormal metabolic state, that growth signal operates very differently. And to understand why, I need to take you back to a discovery made nearly 100 years ago. In the 1920s and 1930s, a German biochemist named Otto Warburg made one of the most important observations in the history of cancer research. He was studying how tumor cells produce energy, and what he found should have revolutionized cancer treatment. Cancer cells do not use oxygen to generate energy the way healthy cells do. Even when oxygen is plentiful, even when it is sitting right there, cancer cells prefer to ferment glucose. They burn sugar through a primitive, oxygen-free process called anaerobic glycolysis. This is known as the Warburg effect, and here is what it means for your breakfast. Fermentation is massively less efficient than normal cellular respiration. A healthy cell produces up to 36 units of energy from a single molecule of glucose. A cancer cell using fermentation produces only 2. This means cancer cells must consume enormous quantities of glucose just to sustain themselves. They are metabolically insatiable. They are glucose dependent in a way that your healthy cells simply are not. Think of it this way. Your healthy cells are like a fuel-efficient hybrid vehicle. They can run on glucose, on fat, on ketone bodies. They are metabolically flexible. Cancer cells are like a broken engine that runs on one fuel only and burns through it wastefully and constantly. Remove that fuel or reduce it dramatically, and you put cancer cells under metabolic stress that your healthy cells never experience. Now, here is the connection that brings this back to your breakfast table. When you eat that bowl of instant oatmeal with fruit and orange juice, your blood glucose surges within 30 minutes. That glucose floods every tissue in your body. Your healthy cells take what they need efficiently, but microscopic clusters of abnormal cells, the kind that research tells us exist in almost every adult body without producing symptoms, respond to that glucose flood the way a fire responds to oxygen. A 2023 meta-analysis published in the British Journal of Cancer analyzed dietary data from over 47,000 adults across 18 longitudinal studies. Their finding: individuals in the highest quartile of dietary glycemic index, meaning those whose diets caused the most frequent and highest glucose spikes, had a 26% higher risk of developing cancer compared to those in the lowest quartile. Not a marginal correlation, a 26% elevated cancer risk, driven by how high your blood sugar goes after meals. A study from the University of Texas MD Anderson Cancer Center specifically examined morning glycemic patterns in cancer patients versus healthy controls. What they found should change how every senior thinks about their first meal. Morning glucose spikes are metabolically more damaging than equivalent spikes at any other time of day. The reason is a phenomenon called the cortisol awakening response. Cortisol is naturally at its highest level in the first 60 minutes after waking. Cortisol promotes insulin resistance, which means the same glucose load causes a higher, more sustained spike at 7 a.m. than it would at noon or in the evening. In other words, the breakfast you eat may be the most metabolically dangerous meal of your entire day. Let me explain what is happening at the cellular level during that spike, because this is where most health content stops short. When blood glucose rises rapidly, insulin surges. Insulin binds to receptors on cell surfaces and triggers a cascade of signals inside the cell. One of the most important of those signals activates a protein called mTOR, the mechanistic target of rapamycin. You do not need to memorize that name. What you need to understand is what mTOR does. It is the master switch for cell growth and division. In healthy cells, mTOR activation is tightly controlled. The signal turns on, the cell grows appropriately, the signal turns off. But in cancer cells, mTOR is frequently mutated or dysregulated. It gets locked in the on position. It keeps commanding the cell to grow, divide, proliferate, and every glucose spike, every insulin surge, keeps pressing that stuck switch harder. A study from the Fred Hutchinson Cancer Research Center followed 3,141 breast cancer survivors over 5 years and measured fasting insulin levels across the cohort. Women in the highest insulin quartile had a 35% higher risk of cancer recurrence than those in the lowest quartile. This was independent of body weight, exercise, and other confounders. Insulin itself, driven by high glycemic foods, was independently associated with cancer returning. Think about what that means. You beat cancer, you endured treatment, you were told you were free, and then every morning you sat down to a bowl of oatmeal and orange juice, and unknowingly recreated the exact metabolic environment that allowed that cancer to grow in the first place. Now, I want to address 4 beliefs I know many of you are holding right now, because this is where the myths run deepest, and where the food industry has done the most damage. The first myth: orange juice is healthy because it is natural and full of vitamin C. Here is the reality. When you eat a whole orange, the sugar arrives packaged with fiber, flavonoids, and water that slows absorption. The glycemic index of a whole orange is 43. When that orange is juiced, all fiber is removed. What remains is a concentrated sugar solution with a glycemic index of 57. 8 ounces delivers 26 grams of sugar, 6½ teaspoons, in liquid form, which absorbs faster than any solid food. A Harvard study tracking 100,000 adults over nearly 2 decades found that whole fruit consumption was associated with lower type 2 diabetes risk. Fruit juice consumption was associated with a higher risk. Same fruit. The fiber makes all the difference. The second myth: I use honey or maple syrup instead of sugar, so it is the healthier choice. Here is the reality. Honey carries a glycemic index of 58 to 72 depending on variety. Maple syrup sits at 54. Both are still sugars that spike blood glucose. Your pancreas does not distinguish between honey and table sugar. It measures glucose, and the amounts most seniors add, a tablespoon or 2, deliver 12 to 17 additional grams of sugar on top of an already high glycemic meal. Natural does not mean metabolically safe. The third myth: I add berries to my oatmeal so the anti-cancer compounds cancel out the harm. Here is the reality. Berries are genuinely beneficial. Anthocyanins, ellagic acid, resveratrol, real protective compounds with real anti-cancer properties. But here is the critical nuance. When you place berries on top of a high glycemic base and consume them with fruit juice, those protective compounds do not cancel out the glucose spike that follows. You are adding a small anti-cancer element on top of a large pro-cancer metabolic event. A handful of blueberries cannot outrun a 172 milligram per deciliter blood sugar spike. The fourth myth: heart-healthy whole grain cereals are safe because they carry a health organization seal. Here is the reality. Cornflakes have a glycemic index of 81. Bran flakes are 74, Cheerios are 74, Raisin Bran is 61, all sold with heart-healthy claims, all creating significant glucose spikes. A 2019 investigation analyzed over 2,500 breakfast cereals and found the average serving contained more added sugar than a glazed donut. The phrase whole grain on a box requires only that 51% of grain content is whole grain. It tells you nothing about total sugar load, glycemic index, or insulin response. And when paired with low-fat milk, which contains more sugar than full fat because fat has been removed and replaced with lactose to maintain taste, the metabolic damage compounds further. So what does this mean for you practically? It means that the breakfast routine you have trusted for decades, the one recommended by organizations you were told to trust, has been creating a metabolic environment in your body every single morning that cancer cells are designed to exploit. That is not your fault. That is a failure of public health communication and food industry influence over dietary guidelines. But now you know, and knowing changes everything. Here is where most health videos fail you. They tell you what to stop doing and leave you without a replacement. That is not acceptable. So I am going to give you the exact protocol right now. The single goal of breakfast redesign is this. You want a morning meal that keeps your blood glucose between 70 and 95 milligrams per deciliter for the entire 2 hours after eating. Achieve that consistently, and you eliminate the morning insulin surge. You shut down mTOR overactivation. You remove the metabolic growth signal that damaged cells are waiting for. Eggs are the single most powerful swap in this protocol. 2 whole eggs from pastured hens deliver 12 grams of complete protein, 10 grams of healthy fat, choline for brain health, and a glycemic index of effectively 0. Your blood sugar does not move from eggs. A study from the University of Connecticut gave overweight adults either an egg breakfast or a calorie-matched bagel breakfast. The egg group had significantly lower blood glucose, a lower insulin response, and reported 34% greater satiety. They ate less for the rest of the day. Add 1 to 2 slices of avocado. Avocado contains oleic acid, the same anti-inflammatory fat found in olive oil, plus beta-sitosterol, a plant compound shown in laboratory studies to inhibit cancer cell proliferation. The fiber in avocado also slows gastric emptying, meaning everything else you eat alongside it is absorbed more slowly and gently. If you want something creamy alongside your eggs, use full-fat Greek yogurt, not low-fat, not flavored, not sweetened. A serving provides probiotics that feed the gut microbiome, including a bacterium called Akkermansia mucinifila. Research from MD Anderson has shown that Akkermansia levels are directly linked to how effectively the immune system can identify and destroy cancer cells. If you want to fight cancer, you need to feed the bacteria that trains your immune system to do it. Add 1 tablespoon of chia seeds to that yogurt. Chia seeds deliver plant-based omega-3 fatty acids that reduce systemic inflammation, plus soluble fiber that forms a viscous gel in your digestive system, physically slowing the glucose response from everything else you eat. That 1 tablespoon changes the metabolic character of your entire meal. I am not telling you to eliminate fruit. I am telling you to choose fruit that protects you rather than spikes you, and to pair it correctly. Blueberries, raspberries, and blackberries have a glycemic index between 25 and 40. They are low sugar, high antioxidant, and genuinely cancer protective. Half a cup of mixed berries alongside eggs or yogurt will not move your blood sugar meaningfully. What you are removing is not fruit. It is the high glycemic base beneath the fruit and the juice beside it. Replace orange juice with green tea. I know that feels significant, so let me give you the mechanism so it does not feel like deprivation. It feels like upgrading. Green tea contains a polyphenol called EGCG. In human studies, EGCG inhibits the very growth pathways that insulin activates in cancer cells. It also specifically blocks angiogenesis, the process by which microscopic tumors recruit blood vessels to grow beyond the size of a pinpoint. A study from Brigham Young University found that adults who drank 3 cups of green tea daily for 3 months increased their natural killer cell activity by 47%. Your morning drink can actively fight cancer rather than feed it. Let me tell you about a patient I will call Margaret. She came to me at 71 years old, 3 years cancer-free after breast cancer treatment. She was doing everything right according to standard recommendations: low-fat diet, plenty of whole grains, daily orange juice for vitamin C. Her fasting glucose on her annual labs was 98 milligrams per deciliter. Technically normal. Her oncologist was not concerned. I put her on a continuous glucose monitor for 2 weeks. What it showed was alarming. Every single morning after her healthy breakfast, her blood glucose was hitting 155 to 168. Normal fasting number. Catastrophic post-meal spike. This pattern, called postprandial hyperglycemia, is associated with exactly the kind of mTOR activation and insulin signaling that drives cancer recurrence. Her oncologist had never tested for it. Nobody had told her it was happening. We changed her breakfast completely. 2 eggs with half an avocado, a small bowl of full-fat Greek yogurt with chia seeds and mixed berries, green tea instead of orange juice. Within 3 weeks, her morning glucose peaks had dropped to 94 to 102, a reduction of more than 60 milligrams per deciliter at the peak. Her afternoon energy improved significantly, and at her next oncology appointment, her CRP, C-reactive protein, a key marker of systemic inflammation, had dropped by 40%. Her oncologist asked what new medication she had started, she said, "Nothing, just breakfast." I want to address something uncomfortable before we close, because I think you deserve the full picture. What I have described today is not new science. The connection between glycemic load and cancer risk has been in the peer-reviewed literature for over 20 years. The Warburg effect was documented in the 1920s. The link between postprandial glucose, insulin, and mTOR activation in cancer cells is thoroughly established. So why is the standard dietary advice from major health organizations, from oncologists, from the breakfast cereal industry, still pointing seniors toward high glycemic morning meals? Part of the answer is institutional inertia. Dietary guidelines are revised slowly, revised by committees, and subject to food industry influence that is documented in public disclosures. The American Heart Association has historically received funding from cereal manufacturers. The Whole Grain Council, the organization that stamps heart check marks on your cereal boxes, was founded in part by the grain industry. These are documented facts, publicly available. But there is something more fundamental. The medical system is designed around treatment, not prevention. Your oncologist is trained to treat cancer with surgery, chemotherapy, and radiation. The metabolic environment that allowed that cancer to develop, that is not covered in most oncology training. The average oncology residency in the United States includes fewer than 20 hours of nutrition science education. 20 hours across a multi-year specialty training. This is beginning to change. Metabolic oncology programs are emerging at a small number of leading research centers, integrating dietary intervention as a formal component of cancer care. But right now, today, most seniors sitting across from their oncologists are not being asked about their breakfast. They are not being monitored for postprandial hyperglycemia. They are not being told what that 172 milligram morning spike means for their cancer biology. That is why I make these videos. Not to replace your doctor, not to frighten you, but to give you the scientific context that the current healthcare system does not have the structure to deliver, so that you can walk into your next appointment with better questions and make more informed choices starting tomorrow morning. Here is what we covered today. The breakfast most seniors eat, instant oatmeal, fruit, orange juice, creates blood glucose spikes that rival a can of regular soda. Those spikes trigger insulin surges. Insulin activates mTOR, the master switch for cell growth and division. In cancer cells with damaged mitochondria, that switch does not turn off. Cancer cells are glucose dependent in a way your healthy cells are not, and morning spikes, because of the cortisol awakening response, are metabolically more damaging than those at any other time of day. The replacement is not complicated, and it is not deprivation. 2 eggs with half an avocado, a small bowl of full-fat Greek yogurt with chia seeds and mixed berries, green tea instead of orange juice. Here is what I want you to do tomorrow morning. Pick one change, just one. Maybe that is swapping orange juice for green tea. Maybe it is replacing oatmeal with 2 eggs. Do not try to change everything at once. One change, held consistently for 3 weeks, creates a measurable metabolic shift you can verify on your own labs. Then come back and add one more. That is how this works. Your breakfast is either feeding your body's defenses or feeding what you are trying to prevent. There is no neutral morning. Every morning you implement what we covered today. You shift your metabolic environment away from what cancer cells need. Every morning you do not, you shift back. That is not pressure. That is clarity about what the science actually shows. You have the information now. What you do with tomorrow morning's breakfast is entirely in your hands. If this video changed how you think about your morning routine, if you learned something that your doctor has never told you, please share it with your spouse, with your sibling, with an adult child who is eating this same breakfast right now without knowing what it is doing. Cancer will affect 1 in 2 men and 1 in 3 women over a lifetime. That is not a statistic. That is someone in your family. The information in this video could genuinely matter for them. If you are not subscribed, please subscribe right now. I publish the metabolic science that the healthcare system is running years behind on every single week. My next video covers the 5 foods that 3 decades of anti-cancer research says belong in every senior's diet, but that almost no oncologist has ever prescribed. You do not want to miss it. Subscribe so it comes directly to you. I am Dr. Edward. Keep asking better questions. Keep demanding better answers. And starting tomorrow morning, make a different choice. I will see you in the next one.